when your doctor tells you need to have any type of major surgery, and each year thousands of women are told they need a hysterectomy. So if you're one of those women, maybe it will ease your mind to know that you can have a hysterectomy with less pain, less blood loss, fewer complications, less risk of infection, less scarring, and a quicker recovery time. Dr. Tracy Thomas Doyle performed the first single-port Da Vinci robotic hysterectomy in the Florida Panhandle area at Baptist Hospital. She lets you know how this modern technology is different from a traditional laparoscopic hysterectomy.
The incision is approximately 3 centimeters, and this actually goes into the incision, so it can actually stretch the incision and make it larger.
Dr. Tracy Thomas Doyle is demonstrating a single-port Da Vinci robotic hysterectomy.
These instruments, they actually move back and forth, basically like your wrists, so you can get better movement around organs and things like that. The traditional laparoscopic instrument is completely straight and has no range of motion.
During a single-port hysterectomy, a small incision is made at the navel, and a port, like the one you see here, is placed in that incision. Your surgeon will then place 3 robotic operating arms through the port to administer the surgery. Dr. Doyle says not only does the Da Vinci single-port system allow her to have more range of motion, but it also allows her to make 1 small incision instead of 1 large one or 3 small ones, which reduces risk factors and recovery time.
Any surgery that you have, you're going to have be at risk of bleeding and infection. But you're going to have much less bleeding with this surgery than you would have with the traditional open surgery. Usually people with an open surgery would lose about a half a pint of blood. With this surgery, you're talking about tablespoons. All my patients go home within 23 hours, usually less than that, but you can do it as an outpatient surgery also.
Dr. Thomas Doyle says the actual surgery takes her between 1 and 2 hours, and it's one of the most common surgeries for women. She says there are a number of reasons a woman may need a hysterectomy, and that's why it's so important for us to get regular checkups. For Fox 10 Healthy Living, I'm Cherish Lombard.
U.S. Surgeon General Regina Benjamin says she